Hi, Ms. Smith is here today, 2 weeks after surgery for her trigeminal neuralgia. Ms. Smith had been suffering from severe right-sided trigeminal neuralgia. For how long were you affected?
Probably a little over a year.
And show us where this pain was when you were having it.
It was all down in here, well, from this side of my face all the way over.
And the pain was like electric shocks, rapid, just lasting a few seconds. But it was very debilitating, is that correct?
Yes, it would bring you to your knees.
Your knees. And when you started having it, did you have any idea what was going on? Or
no.
Did people have a problem figuring out what was going on for a while?
Yes.
That's very common with this condition. People end up going to the dentist and getting teeth pulled and so on and so forth.
I did.
As most people do, because it's not a real well-known problem. Now, I have a vast experience with this problem and the treatment, and what happens is that unfortunately a lot of people don't get diagnosed for a long time and suffer. How bad was the suffering? How bad was that pain?
It was severe. It was very bad.
And so you had this for about a year up until 2 weeks ago.
Right.
And since your surgery 2 weeks ago, what have you experienced?
I've had no pain. No pain
Awesome.
at all up until well, it progressed. The whole year it progressed, got worse. And the last, I'd say, month, I could not, my speech got slurred.
Can't do your daily activities. You can't brush your teeth. You can't, if you're a man, it's hard to shave. Anything you do sets off electrical shocks.
Yes.
Because that's what the characteristic problem is electrical firing of the nerve in your brain due to an artery that's stuck up against it in the back of your brain. That every time it pulsates, it causes a short circuit in that nerve. And that nerve is called the trigeminal nerve. And you have one on each side, but it goes to the face in 3 divisions, one going up here, one in the middle, and one at the bottom. And that pain is also called suicide disease or tic douloureux, the French for spasms or sudden burst of severe pain. And the reason it's called suicide disease is the pain was so bad in the old days when people didn't have any way of knowing what was going on. A lot of people just took their own life because they couldn't live with it. And now, fortunately, we know what it is. Again, our goal here is to educate the public so that if patients are having this pain, it's always on one side. It's not a pain that's constant for days or hours, but it's a rapid onset and rapid disappearance of almost like somebody took an electric cord and stuck it to your face and took it off and back on and forth again rapidly, like machine gun laser fire into your face. And that's the characteristic. It always stays on one side and then it goes away rapidly, comes on rapidly, lasting only for seconds. We see a lot of people that have facial pain that may say, well, my face hurts, constantly or for 4 straight days. That's not trigeminal neuralgia. There's another condition called trigeminal neuropathy that is often confused, but trigeminal neuralgia is exactly what you described, what you had, if the medical treatment fails, which it often does, or patients can't tolerate it frequently because the side effects of the medication. The medicines used to treat it can also cause you to feel drunk and confused, and many people just can't tolerate it, or it breaks through. And was your case tolerance or breakthrough?
It broke through. I mean, medicine did it no good. No good.
Now there's other, as we talked about before surgery, there's other ways to treat it without medicine. I mean, that are treatments. You can burn the nerve, you can radiate the nerve. It's called gamma knife, radiosurgery. You can blow a balloon up on it. So there's several other treatment options. The problem with them is that they don't work nearly as well, and they have a much higher rate of recurrence. And the recurrence rate with typical series on this problem is around 15% in the literature. Fortunately, here at Legacy, it's been much, much lower than that. And the success rate is extremely high. The risk in 2018 of problems with modern equipment, modern anesthesia, modern surgical techniques is very, very low. So I don't discriminate on age. As long if somebody's medically refractory to trigeminal neuralgia pain, or the medicines are causing side effects, I offer them surgery as the frontline treatment in those cases, rather than burning the nerve or radiation side effects and so on and so forth, to avoid the complications of those treatments and to have the lowest recurrence rate. And the only people that I reserve those treatments for are people that just are too sick to have general anesthesia. Not an age. You could be 50 but have terrible heart failure and whatever. So as long, but I've operated on nice folks that were 85 years old with the problem. So it's not an age-related issue in terms of treatment. It is how good your heart and lungs. So as part of our due diligence, we make sure that you're in good medical shape. If you're in good medical shape and you're a candidate, then the surgery goes well. Now let me just show everybody, the incision is right behind the ear because the problem is, this is the healing scar, and you can turn back down. That surgery takes me about 2 hours. I've done several hundred of these, so the success rate of the surgery and the time you have to spend in surgery is all much reduced if you're dealing with a surgeon that does this regularly. The length of stay is usually 1 to 2 nights after surgery. Some people have some nausea, high blood pressure after surgery, even emesis, but usually that goes away in the first day. And then most people have some headaches and just surgical site pain for a few days or weeks. But in the end, most people do extremely well. Now, certainly there's risk of surgery with any surgery, but it's very rare to have a bad problem. And in your case, fortunately, you didn't have any of those, and you've done great.
I've been no pain.
Well, thank you so much for sharing with hopefully the public, so that if they have this problem and their doctors or dentists aren't realizing what's going on, they'll have recognized from you, and most importantly, your suffering's hopefully over forever, certainly over for now, and 95% chance is that it is gone forever. Yes. And we're tapering off your medications. The only reason we're tapering it rather than just stopping it is you can get some withdrawal from the medications. Right. So we're just going to taper it off over a week, and then you'll be done with those silly medicines.
All right.
Thank you very much.